Hi friends, let me share a small trick on managing these posterior plates of these hard cataracts. We find it extremely difficult to laterally separate, especially in these hypermature cataracts where we don't have any epinuclear cushion and the posterior capsule also is thin and vulnerable for tear. So when we are struggling to laterally separate, there's always a risk of inducing PC tear. So is there a way out? So let me take you through one such case. You can see that the rhexis is already done and I'm sculpting. Whenever I see these very dense cataracts, very recently I've shifted to doing the classical stop and chop technique rather than the direct chop, which I was doing just a few months back for all these cases. The reason is the most stress happens when you're trying to have the first crack of the posterior plate. So my goal is to trench it as deep as possible, 90% depth. And then it really requires less manual energy now to laterally separate and divide these fragments. Now once this is done, obviously we still have to break the posterior plate for all the smaller fragments which we're creating. Time to chop the first heminucleus. As the chopper goes down vertically, my right hand is lifting up the fragment. And we can see that the posterior plate is attached and it takes more than 3 or 4 attempts for me to reach the bottom near the posterior plate, and the long length of the chopper tip and my constant pulling up of the PHACO probe along with the fragment helps us to achieve the first crack. But it is very clearly seen that the amount of manipulation required is very much high. So my strategy is always to just take one piece out first now, so you created more space within the bag. So the subsequent quadrants, it will not be so much difficult, and let me share you one such trick here. The remaining fragment is divided into 2 halves, and you can see that at the apex, or at the bottom rather, the 2 pieces are still joined. So rather than attempting multiple times to go behind and try to laterally separate, which is going to cause some stress on the posterior capsule, the quick thing to do is, even though it is not totally attached, begin emulsifying the one fragment. And usually because it is conjoined, along with it comes forward. And at one point you can have an access to the joint area itself. So the fragments are flipped and the joint area is PHACO'd. Once you PHACO the joint area, the 2 fragments are separate now and are individually emulsified. PHACOing the joint area from the posterior aspect is possible only when we have space within the bag. So it cannot be done for the first crack or the second crack. Once one pie of the nucleus is out, then we have enough space to maneuver the nucleus out and then manage. Point to note here is that as the emulsifying is being done, all the process is at the level of the capsular rhexis. So we're quite away from the cornea. One of the fragment which is flown towards the side port is held under the chopper. Once the primary piece is gone, the second piece is brought near the pupillary area and then emulsified. Now time to emulsify the remaining heminucleus. The heminucleus is chopped. The first quadrant is quite clean. The grip was very good and I could position my chopper way deep near the posterior plate and I could get a full thickness crack. The second bigger quadrant needs to be divided into 2 pieces. In this case, there's a loss of a grip, and as a result, I am unable to divide the posterior plate through and through. So now how do we deal with this? So we know that 2/3 of the fragments are separate, but they're held at the apex or the bottom. So I just continue emulsifying the one fragment. With the fluidic movement, the nuclear fragments flip upside down. Now we have access to the posterior part of the nuclear fragment where the 2 pieces are joined. So this is the posterior plate which is in direct view now because the fragments are upside down. And now just PHACO the posterior plate which is holding these 2 fragments together. And lo and behold, we have very easily, we got 2 separate fragments. And again, each of these fragments is emulsified in a very controlled manner at the level of the rhexis. The most important principle to follow is to ensure that the plane of emulsification is right. We need to be as far away from the corneal endothelium as possible, but reasonably safe to be away from the posterior capsule as well. So this is the only secret of having clear corneas. So the remaining fragments are emulsified and the case is done. These are the first day post-op pictures. So the lessons to learn here is, in the event of an inability to break the posterior plate in these hard mature cataracts, there's no need to panic. Just take care that one of the pie is out, then we would have enough space. Then you can always flip the nucleus around, and when the fragment are flipped around, we have access to the posterior plate itself in direct view, and just a tiny bit of phaco energy at this joint area ensures that the fragments are separate. I'm not sure what should be the name given to this technique. I think maybe flip it and phaco the base. Thank you for watching and hope you found this helpful.